Hello, my name is Ben Gallamore, and this is the EHR system connected to an HIE. The target audience is for hospital CEOs and management. So we'll start off with what is an EHR and a HIE. It's an electronic health record, or EHR is simply a digital version of a patient's paper chart. Electronic Health Information Exchange, HIE, allows the data to move. The Office of the National Coordinator for Health Information Technology is the ONC. So EHRs are centered around the patient and are designed to include complete medical records for the patient. It allows patient information, vitals, medications, lab results, etc. to be viewed on a single device by authorized users. Health Information Exchanges is the mobilization of healthcare information electronically across organizations within a region, community, or hospital system. HIEs allow doctors, nurses, pharmacists, and other health care providers and patients to appropriately access and securely share a patient's vital medical information electronically, thus improving the speed, quality, safety, and cost of patient care. The ONC is the principal federal entity charged with the coordination of nationwide efforts to implement and use the most advanced health information technology and the electronic exchange of health information. The position of National Coordinator was created in 2004 through an executive order and legislatively mandated in the Healthcare Information Technology for Economic and Clinical Health Act of 2009. So why do we need an EHR system? Some of the benefits to implementing an EHR system include clinical benefits, financial benefits, benefits to the patient, and other benefits. A main benefit to an EHR system is allowing healthcare providers to see the whole patient and connect all the healthcare needs together. For example, if a patient goes to another location for a medical need, that information will be entered and available for their primary care physician. Test results, labs, x-rays will be available to other doctors that may have an interaction with the patient. Doctors will be able to get up to speed quicker on their patient's conditions. This will allow them to ask more pertinent questions related to their issues without having to ask all the basics if there is no change there. All these factors will aid in the better workflow for all medical personnel. They will be able to see more patients and serve them better. Some other clinical benefits to an EHR allows the doctor to set up a pre-visit agenda setting. This is a simpler example would include a recurring diabetes care plan to check up on a wellness check. The doctor has their baseline information in the EHR so they can look for changes in progress. A more complex example is if you have a new patient or if they have multiple issues. However, once their information is in the EHR, it will make their next visit much simpler. Some financial benefits to an EHR. By switching over to an all-digital format for patient records, many cost savings are inherently incorporated as a result. Physical storage space of paper records nearly disappears. In addition to this, time spent filing, organizing, and pulling records is eliminated. With a click of a mouse, you have all the information at your fingertips. Man-hours lost to looking for misplaced records, calling other medical facilities for information, etc. will be greatly reduced. Documentation will be improved and automated functions will save time. Less mistakes will occur with multiple entries of information. Also, the medical coding process will be much faster. There is less chance for medical errors when prescribing medications. There are built-in auto checks that will look for drug interactions using medical lists, which is also a requirement under the ONC certification. This saves money by reducing the number of medical malpractice lawsuits. Benefits to the patient. Patients will see and experience many benefits as well. Patient portal webs have proven to increase the health of those patients who use them, allowing them to follow care plans and ask questions that they may have. Reliable point of care information and reminders notifying providers of important healthcare appointments and interventions. E-prescriptions are sent directly to the pharmacy. No need to carry a paper prescription that may get lost or stolen. Less forms to fill out when you arrive for an appointment. That information will already be in the system, so you just need to note any changes that need to be made. Potential issues with the EHR implementation. As with any change, there will be issues to overcome. Proper planning and coordination will aid in minimizing the impacts of this change. Some issues might include cost, end user pushback, and security of data. Costs. According to Ironman.com, a health affairs study found that a typical multi-physician practice would spend about $162,000 to implement an EHR, with $85,500 for the first year maintenance cost. According to that same article, practices can expect to cover the cost of an EHR in approximately 2.5 years, and they receive approximately $23,000 per year per full-time employee in net benefits. The study also outlines several areas in which an EHR can provide tangible benefits to the practice, including increased efficiency, increased quality of care, reduction of waste, and fewer medical errors. Some end user pushback may be experienced as well. People get used to a certain way of doing business and can resist change. Some ways to make this change for a smoother process include the following. Clinicians will need to be a driving force for a new EHR system. They, along with the nurses, are going to be the ones using the system day in and day out. If they are not happy about the way the system performs, then their work and in turn patient care will be impacted. Proper training needs to occur before any implementation is made. The time to train is not when you are evaluating patients. Many times there is training, but it is only an overview, and the clinical personnel do not feel totally comfortable with it. They need the time to click around and learn where everything is before the added pressure of a patient is introduced. Avenues for feedback need to be available from the very start. This will help find issues with the system and find any bugs that may make the system incompatible with their operations. It also makes the employees feel like they are part of the change and can take some ownership in it. Security of data. As with any computer program, there's a risk of cyber attacks and information breaches. A professional cybersecurity company could provide defenses such as monitoring physical system access, can include creating physically inaccessible systems to authorized users, providing identification and verification requirements to all system users, regular audit of all authorized users, issuing specific punishments to employees that do not follow the guidelines, constructing a security plan for data disposal, and backing up all data from all hardware. And again, this is an ONC certification that ensures privacy and security of your data. Why connect our EHR to an HIE? As you have seen, having an EHR at our location is vital. Once implemented, it will need to be connected to an HIE. HIEs help facilitate coordinated patient care, reduce duplicative treatments, and avoid costly mistakes. This practice is growing among health providers because of the need for HIE is clear and the HIE benefits are significant. Some benefits also include providing a vehicle for improving quality and safety of patient care by reducing medication and medical errors. It stimulates consumer education and patients' involvement in their own health care. It improves public health reporting and monitoring and reduces health-related costs. And this is my reference page. And thank you very much.